So I'm going to be showing how to do a gymnastics ankle taping technique. This is going to allow the ankle to be able to plantar flex or toe point during either competition or practice. It does allow some movement at the ankle, so if you are doing this for an acute ankle sprain, I would suggest doing more support versus less, but I'm going to show you the one that I would use for a gymnast that needs more ankle toe point. Sometimes you can use the what we call prewrap. This goes underneath the tape. For these purposes of the demonstration, I'm not going to use it, but you are allowed to use that. So we always want to put our anchors down. These have very little tension, if no tension at all. We just leave them there so that our strips can actually grab hold onto something other than skin. You're going to start your stirrups next. I put 2 anchors and then we can start our stirrups. You always want to start on the inside of the ankle and you're going to pull to the outside. And then we do a weaving technique. So we're just going to do 1 stirrup and 1 anchor. And we always want to pull up at the end. When we do 3 stirrups, we have completed the stirrup portion. And we just keep making our way down the ankle to the foot. I see a lot of people stopping their anchors or their strips before we get here. In order to prevent blisters, ideally you want to put a strip down here. The difference in my ankle taping that I'm doing today versus something that's more supportive is this is as far as I go. A lot of times you will see an extra strip down here. I do not do that strip. We'll start on the outside. Now we go into what is called our heel locks. We're just looping around the heel. You can either do this continuously, like this, or 1 strip at a time, like this. Once you have done 2 on each side, you can do what's called closing up, which is basically anchors to close up the loose ends on the top. And once you've done that, you've completed your ankle. Go ahead and give me a toe point, but it also allows for a toe point. This next taping technique is for arch taping. So if we have someone who might be experiencing some shin splint pain or some arch plantar fasciitis type pain, we can do a very simple taping technique. It's one of my favorite because it's the easiest, and the athlete themselves can learn how to do this on themselves in the gym. So all you need is 1 roll of tape. You will always start on the outside of the midfoot. This part you lay down, not a whole lot of force, but you will pull up through the arch and then gently lay it down. You will do this 2 or 3 times depending on how large the arch is. And now we have recreated an arch for our athlete. So sometimes we have arch pain, but the same taping technique can also be utilized for base of the 5th metatarsal fractures when they're coming back from the fracture and easing back into sport, or a sprain on the outside of the foot as well. The same technique goes for both. So now, not only have we helped support the lateral or the outside of the foot, we have also helped create an arch for the inside of the foot. Now Bailey's going to show you how to do a patellar tendonitis pre-wrap strap. So what she's going to start with is create mild tension in the pre-wrap. And she's going to go just beneath the bump on her knee. She's going to go around 2 or 3 times, maybe 4 times. She's going to rip it and she's going to roll it right on up. They're going to look for and feel for the kneecap and the bump, which is called the tibial tuberosity. And those two are your landmarks. And you're going to want to put this strap right in between the two. This is great for patellar tendonitis, patellofemoral pain, and anything that has to do with knee pain during jumping. So try this out because it's very easy to do. Now I'm going to show you how to do a simple knee taping with kinesiotape. I have already pre-cut my strips to show you. I have 2 medium length and 1 smaller length. A lot of the times your kinesiotape will come in pre-cut strips, and you can just cut one of the longer strips in half for the 3rd strip. I have already sprayed Bailey with a quick adhesive tape adherent, and I do it in the exact place that I'm going to be laying down my kinesiotape. To start off, we're going to tear away our anchor. We're going to find the bump down here, our tibial tuberosity, and we're going to just lay that down. We're going to bring this tape and follow it along the kneecap so that it hugs right along that inside edge of the kneecap. We're going to do the same similar thing on the other side. We're going to find that tibial tuberosity, the bump below the kneecap. We're going to peel away, we're going to stretch it out, and we're just going to follow the outside of that kneecap, laying it down. Then I like taking the glossy side of the backing and rubbing pretty vigorously. This actually creates friction, which actually will increase the adherence to the skin, keeping the KT tape on longer. The great thing about this tape is you don't have to take it off every day. You can shower with it, you can sweat in it. So you don't actually have to reapply it every day. And actually it's best if you don't, because the skin can get a little irritated. You can also keep it just as is, but if you are having patellar tendonitis as well, you can do a 3rd strip. Bailey's going to bend her knee. We're going to expose the middle of the kinesiotape. We're going to put it right between the patella and the tibial tuberosity. And we're going to lay that down with a lot of tension on both sides. And again, we can use the backing to create friction and getting it to stick longer. This is a great way to tape for a knee support during competition or during practice, especially for chronic knee pain, for patellofemoral pain syndrome, for plica, for patellar tendonitis, and any other chronic knee issues. Now I'm going to show you how to do a simple taping technique that can actually be a great addition to multiple different injuries at different joints. This is called a fan technique. You will lay 3 strips of tape. White tape is just fine. And this can easily prevent hyperextension, or in Bailey's case, I'm going to show you how to do it for wrist extension. We all know what tiger paws are, but sometimes our athletes don't have tiger paws in their possession when they injure their wrist. So this is a really easy way to mimic that in tape form. So basically what you're going to do is you're going to lay out 3 strips like this. You're going to lay your tape down on the wrist and through the hand. And then you're simply going to apply it in a slightly flexed wrist position. Then you're going to tape back over it, making sure that all of the ends are down. And when you do that, now you can see that Bailey has limited wrist extension, so instead of having to order tiger paws that day, she can try this technique out instead in the gym. This is also a great technique if you have hyperextended your knee mildly, or if you have hyperextended your elbow in practice. The same technique will apply. You will just have the fan technique, putting your anchors above and below and wrapping it up. And that will keep her from overextending her joint.